Hi, I'm Dr. Jonathan Pontell, and we're going to be talking about rhinoplasty. So there are two basic kinds of rhinoplasty. There's open rhinoplasty and closed rhinoplasty. We do 99% open rhinoplasty. And what that means is there's a small incision in the columella here, and that incision is connected to internal incisions. And that allows us to lift the skin up and look inside at the structures of the nose and to make very sophisticated, very precise changes. When we have the nose opened up, we are able to use cartilage grafting and do special suturing techniques that are pretty much not possible with closed rhinoplasty. And this allows the results to be really just far superior, in my opinion. A rhinoplasty takes about 2 hours. After rhinoplasty, patients have a cast on. They come back a week after surgery, we remove the cast, and we start taking stitches out. They come back a week later, and we take the second set of stitches out after that. We tell patients that for the first 2 weeks after surgery, they need to be extremely careful about their activity. We don't allow patients to work out for that 2-week period. After that 2-week period is over, they can start working out, but again, they're careful with avoiding any kind of trauma to their nose. So results are actually seen a week after surgery when the cast comes off. It's not the final result because there's swelling and there's healing that has to still happen, but they still have a good idea of the change that's occurred. If there was a big bump, the bump will be gone. If the tip is very wide and bulbous, the tip will be less wide and bulbous, even though it's still swollen. With any surgery, there are risks. Thankfully, complications are rare. With any surgery, there can be an issue with bleeding, infection, a reaction to a medication. But again, these are very rare. We use computer imaging like a lot of doctors do, but we use that computer imaging to make a surgical plan. So once we've done the computer imaging and the patient is happy and I'm happy with the proposed changes to the nose, we use that computer imaging to make a tracing. And what I do is I actually place tracing paper over the computer. I traced out the silhouette of the nose before surgery and the nose after the proposed surgery, and that shows me the exact differences, the changes that I want to make. So if I want to lower the bridge by 4 millimeters, or I want to raise the tip up by 2 millimeters, whatever the measurements are, it allows me during surgery to be very precise. And this allows me to get results that will be very close to what the computer imaging showed. So when we look at doing a rhinoplasty, we look at the entire profile. Often a patient will have a chin that's underprojected or weak, and doing a chin implant along with a rhinoplasty can really be a powerful, positive addition to the surgery. Balanced profile is far more attractive than an unbalanced profile. The other thing to think about with a chin implant, patients who have a weaker chin tend to age around their mouth and their neck prematurely. So patients who do benefit from a chin implant, not only does it help their immediate result, where their face is in better balance and in harmony, it helps them age at a much slower rate because the soft tissues around the mouth and the neck are supported so they don't droop prematurely. So I've done about 5,000 rhinoplasties. About 40% of those have been revision surgeries. These revision rhinoplasties were done initially by another surgeon in the vast majority of cases, and they tend to be complicated cases, cases where noses have issues aesthetically, functionally, but thankfully, in the vast majority of cases, we're able to fix the aesthetic and functional issues. In most cases, we're able to give the patient what they were looking for initially. Patients typically are thrilled with the results of their rhinoplasty. It's great to take a cast off of a patient and see their smile and see them light up. Patients who are feeling uncomfortable and self-conscious all of a sudden feel great about themselves, and that is incredibly gratifying. I remember a patient, 17-year-old boy, who really was self-conscious about his nose and was really minimally communicative, really didn't speak a lot at all. And I saw him about 6 months after surgery, and he was like a different kid. He was talking and happy and smiling, and it was just amazing to see the change. For anybody who's interested in a rhinoplasty, the best thing to do is to come in for a consultation. We'll look at lots of before and after photos of other patients that I've done. We will do computer imaging. Computer imaging is a great tool because we're able to make infinite changes to the nose and make sure that we're all on the same wavelength so that we can get the result that you're looking for.